Hi everybody, this is Paul Girard. I'm a student loan consultant working with the American Dental Education Association, and this repayment module is on the income-driven repayment plans. Now this is the second module we have on income-driven repayment plans known as IDRs. The first one that we hope you have seen is more of a generic background on how the plans work and how you qualify for them and the different types of plans. This one specifically looks at two of the more recent income-driven repayment plans, Pay-As-You-Earn, known as PAYE, and Revised Pay-As-You-Earn, known as REPAYE. And the intention of this module is to help you determine which of these two plans will be the best repayment plan for you if you choose an income-driven repayment plan as part of your repayment strategy. Now, if you're going to use an income-driven repayment plan or IDR as part of your repayment strategy, you may want to consider using the plan with the lowest required payment. That is why this module is going to look specifically at Pay and REPAYE. The reason we say that is, remember, you can always overpay with no penalty. That most certainly includes an income-driven repayment plan such as Pay or Revised Pay-As-You-Earn. But remember also that if public service loan forgiveness is part of your repayment strategy, you actually want the lowest payment, because the lower your payment under an income-driven repayment plan, the higher the forgiveness amount is going to be under public service loan forgiveness. That is why, again, we are looking specifically at Pay and REPAYE, because the initial payments in these plans are almost always lower than income-based repayment, known as IBR, and the much older plan known as income contingent repayment, or ICR. You can get information on IBR and ICR from your loan servicer or at studentloans.gov, but what we think you will find is when you run the repayment numbers under the various calculators for these plans, the monthly payment under IBR and ICR are going to be higher, at least initially, than you will find with Pay-As-You-Earn and Revised Pay-As-You-Earn. Now let's take a look at the differences between Pay-As-You-Earn and Revised Pay-As-You-Earn. First of all, a reminder, these two repayment plans are only available on federal direct loans. So if you have any federal loans that are not in the direct loan program, you can consider consolidating them and flipping their balance into the direct loan program and then applying for Pay or REPAYE on your entire balance, depending on your eligibility for these repayment plans. Note also that Pay-As-You-Earn is only available for new borrowers as of October 1, 2007. That's called a trigger date. So if you had any federal debt before October 1, 2007, and you did not pay it off in full out of pocket before you took out another federal loan after that date, you cannot even apply for Pay-As-You-Earn. So the easy way to think about it is Pay-As-You-Earn is only available for new borrowers as of October 1, 2007. There is no such requirement under REPAYE. It's available for all borrowers regardless of when you started borrowing. The payment calculation under both Pay and REPAYE is the same. It's 10% of discretionary income. By the way, IBR is 15% of discretionary income. That's why the payments under IBR are higher. But notice under Pay, you are never required to pay more than the original standard 10-year amount. That's a protection that's available under Pay-As-You-Earn that is not available under Revised Pay-As-You-Earn. With REPAYE, you always pay 10% of discretionary income. There is no payment cap. Now, some additional differences. The repayment term with Pay is 20 years. The repayment term with REPAYE is 25 years unless all the borrowing is for undergrad or college, at which point the term under REPAYE is 20 years. Clearly, for dental school graduates who borrowed, it's going to be 25 years. What this simply means is after 20 years with Pay or after 25 years with REPAYE, if there's a balance remaining, regardless of what kind of employment you've had, the debt will be forgiven. That's the forgiveness provision under Pay and REPAYE. But a reminder, unlike public service loan forgiveness, the amount forgiven after 20 years with Pay and 25 years with REPAYE is subject to tax based on current law. In terms of capitalization, remember that capitalization is where the accrued and unpaid interest is added back to the principal. There is a limit to how much can be done under pay-as-you-earn. It's 10% of the original principal amount. There is no limit to the capitalization amount under revised pay-as-you-earn. Very important difference for married borrowers. With both pay-as-you-earn and repay, if you are married and you file a joint tax return, spousal income will be counted. It will be listed under your adjusted gross income on your tax return. However, with pay-as-you-earn, the original plan, if you file separately, spousal income is not included. But with revised pay-as-you-earn, spousal income is included in the calculation of the payments regardless of filing status. So very important difference for married borrowers. And finally, a few more distinctions to make between pay and repay. There is an income requirement under pay-as-you-earn. You actually have to meet a threshold that's called partial financial hardship that looks at your income, your family size, and the poverty level for a family of your size in your particular state of residence. There is no requirement or income requirement under revised pay-as-you-earn. That's why there's no payment cap under revised pay-as-you-earn. Notice the next difference, very important. There is no subsidy on unsubsidized loans with pay-as-you-earn, but with revised pay-as-you-earn, if the interest that you owe, the interest alone that you owe each month is higher than the calculated repay amount, the government will subsidize 50% of that difference. Anytime interest due is higher than a payment amount, that's called negative amortization, and that causes your balance to grow. The government is simply saying with repay, if the interest that's due is higher than the repay calculated monthly payment amount, the government will slow down the growth of your portfolio by 50%. It's a 50% interest subsidy on unsubsidized loans, and there's no limit to how long that will happen. So if you have a big gap between the amount you owe and your income, this is likely to help you a lot. This is one reason many of the graduates that we talk to, especially those going into residency programs at hospitals where their stipend is significantly lower than their debt, are interested in repay. Both of these plans count as eligible repayment plans for the Public Service Loan Forgiveness Program. We hope that the information in this module, this comparison chart of pay versus repay, will help you know which of these two plans would be best for you if, in fact, you decide to use an income-driven repayment plan as part of your repayment strategy. Be sure you've seen the other module on income-driven repayment plans. That should help you as well. Good luck and best wishes from the American Dental Education Association.